Hello, everyone. Welcome back to the podcast. Today, we're talking about DOJ's announcement of a new West Coast healthcare fraud strike force and why, for my colleagues and friends and partners here on the western part of the United States, this development matters for healthcare providers, digital health companies, compliance officers, boards, and investors. This announcement reflects DOJ's continuing expansion of one of its most successful enforcement models, the Healthcare Fraud Strike Force program. And importantly, it also highlights several larger enforcement trends involving data analytics, artificial intelligence, telehealth scrutiny, private equity oversight, and increasingly aggressive federal coordination. The Healthcare Fraud Strike Force model was originally launched in 2007 through cooperation among DOJ, Department of Health and Human Services, FBI, HHS, OIG, CMS, being Medicare, and other agencies. The goal was to create highly specialized, data-driven enforcement teams focused on identifying and prosecuting complex healthcare fraud schemes. The strike force model has been extraordinarily successful. Over the years, DOJ has brought thousands of prosecutions, recovered billions of dollars involving Medicare fraud, Medicaid fraud, kickbacks, durable medical equipment fraud, laboratory testing fraud, telemedicine schemes, and opioid-related misconduct. Now DOJ is expanding the model further with a new West Coast strike force. And as I always say with regard to enforcement priorities and results, when the department allocates resources, watch out, because the resources will produce. And the West Coast presents several unique enforcement priorities. The region includes major concentrations of healthcare providers, managed care organizations, digital health startups, telemedicine companies, pharmacies, laboratories, and technology-enabled healthcare platforms. There is also a substantial private equity investment flowing into healthcare operations throughout the region. Regulators appear increasingly concerned about technology-enabled fraud schemes that can scale rapidly across multiple jurisdictions. Telehealth is a particularly important focus area. During and after the COVID pandemic, telemedicine expanded dramatically. While telehealth creates enormous patient benefits, it also generated significant enforcement concerns involving improper prescribing, inadequate medical necessity reviews, patient recruitment schemes, kickbacks, and fraudulent billing practices. Federal prosecutors have repeatedly targeted telemedicine arrangements involving marketing companies, call centers, laboratories, pharmacies, and referral networks. Another major development involves DOJ's increasing reliance on advanced analytics and AI-driven investigative tools. Modern strike force investigations are highly data intensive. Regulators now use predictive billing analytics, claims anomaly detection, provider relationship mapping, prescription utilization tracking, and referral pattern analysis to identify suspicious conduct. In many cases, investigators can identify aberrational billing patterns in near real time. This creates major implications for compliance programs. Organizations need to be a step ahead of the enforcement agencies, and they need to use continuous auditing and monitoring systems capable of identifying emerging risks quickly. Another important issue is private equity and investor scrutiny. DOJ has repeatedly expressed concerns regarding investor-driven growth strategies in healthcare, and prosecutors are increasingly evaluated whether aggressive revenue incentives, rapid expansion pressures, consolidation activity, or inadequate oversight contributed to compliance failures. This means enforcement risks are no longer limited to providers alone. Boards, executives, management companies, and investors may face heightened scrutiny regarding governance and oversight responsibilities. From a practical standpoint, billing compliance systems are a targeted area, specialized telehealth controls, strong third-party due diligence, active board oversight, and effective internal investigation capabilities that is nimble and can move quickly. The broader takeaway is that DOJ continues investing heavily in specialized healthcare enforcement infrastructure. They're combining sophisticated analytics, whistleblower incentives and information, interagency coordination, criminal enforcement, civil False Claims Act investigations, and technology-driven monitoring. Healthcare organizations face an increasingly aggressive and sophisticated enforcement environment. Companies that proactively strengthen compliance systems, governance structures, auditing functions, and risk management programs will be far better positioned to manage those evolving risks. The creation of the West Coast Strike Force is another strong signal that healthcare fraud enforcement remains one of DOJ's highest priorities and that regulators are continuing to expand their capabilities rapidly. Thanks again for joining me, and I look forward to speaking with you again soon on Volkov Law TV.